need 5 minutes here. I'm just got a little bit of an IT issue on my end. I'm just trying to resolve.
Not a problem. We are live now. We're waiting for Councillor Columbus.
Okay, well, we'll give him a couple minutes. That'll give me 2 seconds to sort this out. Thanks.
Okay. I heard from Councillor Columbus. He's just having some IT issues. We're resolving them behind the scenes. Board Chair Chop, we can proceed with the meeting. Board Member Columbus is going to come on a little bit later. He's got some IT issues.
Okay, sounds good. Thanks, Kevin. Just give me 1 second here. Okay, well, good afternoon, everyone. I would like to remind you that our meetings are web streamed and televised, and if you could please all ensure that your phones are on silent mode. Following the Board of Health meeting, the Public Hearings Committee will begin at 3 p.m. on this same link. If I could have a motion then to approve the agenda, and with that I'll call the Board of Health to order. Councillor Taylor, sorry, and seconded by Councillor Rabbits. All those in favor? And that is carried. Any declarations of pecuniary interest? All right, seeing none then, we are going to move on right away into the presentation from our Medical Officer of Health, Dr. Strauss. Welcome, Dr. Strauss.
Thank you, Board Chair. It's always a pleasure to address the board through you. A little bit, I guess this update's a little bit different. It's only been 3 weeks since our last meeting and my last update, so I have a little bit less to report maybe than usual. Provincially, the Omicron wave seems to have peaked. Hospitalizations and ICU admissions are coming down. Deaths appear to have plateaued. I want to temper the optimism involved in that statement by saying, as in previous waves, I'm seeing some signs that perhaps our experience is going to lag a little bit here. Our hospitalizations didn't start to go up until a few weeks after the Omicron wave really erupted in Ontario. And we have not yet seen a plateau or maybe even a peak in Halden and Norfolk. So today there are 19 residents of Halden and Norfolk who are in hospital with COVID-19. There's been a lot of provincial discussion about this issue of in hospital with COVID versus because of COVID. I can say that 8 of the individuals from Halden and Norfolk who are currently hospitalized did not go to the hospital because of COVID infection, but were in fact infected at the hospital in the context of a hospital outbreak. So that's some important context to bear in mind. I am sorry to report that there have been 2 deaths in our community from COVID-19 since we last spoke. As we've spoken about in previous meetings, about 20 residents of Halden and Norfolk die per week, just in general, prior to the pandemic. The 2 individuals who died of COVID-19 in the last 3 weeks, I'm sorry to say, were elderly with significant medical problems, and unfortunately were unvaccinated. So that obviously, I'm sorry to have to say. As our hospitalizations for COVID-19 have not yet necessarily peaked, I think it's probable that we'll see more COVID deaths in the next few weeks in this population. So even as we brace for that impact, I do think it remains the case that we're about to see the end of this chapter. It is the case that the vaccinations have prevented an incredible number of deaths, and I think we can see the end. In my discussions with provincial officials, with my MOH colleagues across the province, and indeed in terms of what provincial officials have said publicly, I see every indication that our province will be reopening, and this chapter will be behind us soon. So in that context, as a health unit, we are excited to start back up all the other work that the public health requires, and that has really been on the back burner the last 1.5 years, almost 2 years. So I hope that the next time we speak, we'll be talking about the Healthy Babies, Healthy Children program ramping up. I hope we'll be in schools doing all the traditional vaccine clinics, measles, mumps, rubella, that sort of thing. I hope that the doors of the public health unit will be opening and we'll be cleaning kids' teeth again, and visiting schools to talk about nutrition. So all of those things. And then as a bit of a coda to my presentation, as you're all aware, of course, the board passed a resolution in December asking for an opinion on kindergarten masking. I prepared that opinion as requested on the advice of the county clerk and the acting GM. I delivered that opinion to the Health Advisory Committee last week. So I won't repeat that presentation here, but I have included a written copy in the package for today's meeting. So I'm of course happy to take your questions on that matter or any other matter that you'd like to ask about. Thanks for allowing me to address you today.
Okay, thanks, Dr. Strauss. Councillor Huffman, go ahead.
Thank you, Board Chair Chop. Through you to Dr. Strauss. In regards to some of the numbers, I know that we get a lot of the stats regarding COVID. I was just wondering, do we have any kind of numbers regarding our opioid related deaths during the same time period?
I'm sure such numbers are accessible. I do not know them off by heart. I am more familiar with provincial numbers. So there recently was a very large study, I think prepared by, I can't recall if it was from researchers using coroner data or from actual researchers in the coroner's office. But provincially, there's been a doubling in opioid deaths in males, or 1.8 times over the pandemic period. I previously had seen a study showing in that first 6-month period provincially, in 2020 of the pandemic, opioid deaths in people under 50 had quadrupled. So I do not expect our local numbers to be any happier on that point. I think it's a humongous issue, and frankly, now that you raise it, I should have enumerated it as one of our major concerns going forward when we
Okay.
resume normal health unit activities.
Yeah. Did you by any chance get a chance to watch the agenda last week when they discussed the opioid crisis in the northern parts of the province and rural areas?
The agenda was Steve Paikin?
Yes.
No, I did not. I'm sorry.
Okay. It was very informative. So now, following up on the report that you provided to Health and Social Services and that we have a copy of, I just wanted to add that I was able to do a little bit of research, and I wanted to add that the school boards who require JK-SK masking in our surrounding areas are Thames Valley District School Board, the Hamilton Wentworth District School Board, Brent Haldeman Norfolk Catholic District School Board, the Upper Grand District School Board, the Greater Essex County District School Board, the District School Board of Niagara, and the Waterloo Region District School Board are all areas within our vicinity who require JK and SK masking. And I just wanted to add that because I know that we had talked about it and you had said that you were looking at getting that information.
Sure. I guess I would say after your question, I took an interest in it, and I did some searching around to see what I could figure out, but it wasn't possible to sort of scientifically figure out with the resources I have what all 34. I mean, there's obviously more than 34 school boards, so I couldn't tabulate province-wide statistics on that point. It did appear to be the case that, and I did find news reports to show that a couple of public health units that previously did not have kindergarten masking right up until January had changed their mind. I believe Niagara was one and Huron-Perth was one. But again, it was sort of an ad hoc, not really statistically accurate effort on my part.
Okay.
Member Van den Riche, go ahead.
Thank you, Madam Chair. Through you, I read your report, and I'll start there. This, of course, is school board jurisdiction. This is not our jurisdiction. It doesn't belong to us. It's not in our wheelhouse. So anyway, at the end of the day, it's their jurisdiction and their decisions to make and reasons why. And I think I was a little bit disappointed that I saw a lot of information about Europe, and I live in Canada, and we all do here. I'm saddened to see that you didn't use very many statistics from Canada or Ontario. So that was something. But at the end of the day, there are private schools as well. Like the deputation, the father that presented that his child, of course, goes to private school. Not any of our school boards isn't in a school of any of our boards here. So anyway, and their policy also, I did some research, their policy, especially something like the Montessori school, their policy is for masking in kindergarten. So anyway, good to see your report. I'm sorry that we spent too much time on it because it is not our jurisdiction, and but good always to have information, and glad to hear you were making a recommendation, but that's something you'll be discussing with the boards and of which you do on a regular basis have meetings with school boards, correct?
Oh, absolutely. And as I freely acknowledged at the December meeting, this has been dispensed to the school board's authority. But in my view, when I am asked for independent medical advice, I give independent medical advice. And so anytime the board asks me to render an opinion, I will. And what other governing authorities decide to do with that opinion is their business.
That's absolutely correct. Anyway, good to hear. Thank you very much.
Further questions from the board? Member Martin, go ahead. No questions? Member Van Passen.
Yes, thank you, Madam Chair. And I'll agree with the board members. This is a school board issue, but when we get to the point where we receive this report as information, I like to amend it that we do forward this report to the appropriate school boards so that they have it for information. They can deal with it as they choose. But at least we asked the doctor for his opinion. I read in the paper the school boards are already know what his opinion is. They're already thinking about it. So we should at least officially forward this on to them so that they have the actual report. So, or if you're ready to take that motion to receive the doctor's report for information with that addition to it, I'd be happy to move that, Madam Chair.
Thanks. Do I have a seconder for Member Van Passen's motion? Thank you, Member Michelle. Any further discussion on that? All those in favor? And that is carried unanimously. Moving on, thank you very much, Dr. Strauss, for joining us. I think it's a pretty short meeting here today. We're just moving on to the approval of the minutes. We have the closed minutes for the regular Board of Health meeting of December 7th, 2022, the minutes for the regular Board of Health meeting of January 11th, 2022, and the minutes for the special Board of Health of January 13th, 2022. Could I have a motion to approve, the minutes as presented? Member Rabbits, thank you. Seconded by Member Van Den Riche. All those in favor? And that is carried. We don't have any items of communication. Are there any general announcements from the board? Okay, seeing none, I will move on with the confirming bylaw. That'll be bylaw 2022-03BH, being a bylaw to confirm the proceedings of the regular Board of Health for the Haldimand Norfolk Health Unit at this Board of Health meeting held on the 1st of February 2022, to be approved, signed by the chair and board clerk, and affixed with the corporate seal. Mover and seconder, please. Member Michelle, seconded by Member Van Passen. All those in favor? That is carried. And finally, a motion to adjourn. Member Huffman, thanks, and seconded by Member Rabbits. All those in favor? That is also carried. So with that, Board of Health is adjourned, and we will see you back on the same link at 3 p.m.